Welcome to Understanding Your Response to Trauma by Dr. Don Hicks, adapted from North American Mission Board. Among the many stressful experiences of living, we can be faced with extraordinary circumstances that leave us feeling terrified, powerless, or horrified in the face of threatened or even actual injury or death. Examples are as follows: natural disaster, catastrophe caused by human error, catastrophe caused by failed equipment, physical or sexual assault, rape, robbery, mugging, serious motor vehicle accident, witnessed violence, injury, or death, combat, torture, or imprisonment, threats of harm to self or loved ones, domestic violence and abuse, fire and burn survivors, destruction of one's home. Sometimes immediately, and sometimes after brief or even extended delay, most of us will experience intense feelings and symptoms related to the traumatic event. Not every person experiences the same aftermath of trauma. However, you are likely to bounce back and forth between periods during which you relive the trauma and other periods during which you are numbed of feelings and avoidant of any thought or reminder of the traumatic event. This is entirely normal. This normal acute response to trauma is called post-traumatic stress. Unless it is persistent over time and does not gradually heal, you should seek treatment. Bullet 1. You may experience flashbacks in which you intensely relive the trauma, as if it were really happening again. You may feel all of the same emotions and sensory experiences again. You do not lose consciousness during a flashback, but you may have difficulty distinguishing here and now. Reality when a flashback consumes you. This can be a frightening experience, especially since you may see, hear, smell, or feel things related to the past traumatic event that are not actually there in your current reality. This does not mean that you are losing your mind, okay? Such flashbacks are entirely normal, part of the response to trauma as you struggle to rework, reintegrate the experience. If you had another traumatic experience years before this one, you may even find that sudden flashbacks about the experience get mixed up with the flashbacks about your more recent traumatic experience. You may have nightmares that vividly replay the traumatic event, or that just show fragments of the experience. You may have nightmares that repeatedly replay themes of helplessness, horror, anger, or other feelings related to the trauma. You may awaken very upset and sweating profusely without remembering the nightmare. You may often feel too wired to sleep. Your nightmares may be so alarming that you become fearful of sleep. You may associate darkness with danger. Being left alone with your thoughts without the distractions of your daytime activities may prompt memories of trauma which make it difficult to sleep. Coffee or alcohol may interfere with your sleep like never before. Persistent insomnia or awakenings during the night could also be a sign of developing depression, which can be treated with medication and talk therapy. You may experience sudden panic, irritability, anger, grief, horror, or vague sinking feelings that sometimes seem to come out of the blue. Sometimes you may recognize at the time or later that your feelings are in response to a reminder of the trauma that you've experienced. Such reminders can be obvious or they can be so subtle that you may not easily recognize them as connected with the trauma. You may also experience strong feelings when faced with a monthly or annual anniversary of the traumatic event. You may find that quiet, unpredictable, you dissolve under ordinary stress that you would usually take in stride. You might find that music is intolerable, that children's behavior or noise is hard to take, or that you can't watch television because of the feelings that will come back. Although your emotions may be very intense at times, at other times they may be so much the opposite that you may feel dull, empty, numb, or completely shut down. You may feel emotionally dead or like a robot without feelings. You may feel remarkably detached and estranged from others. You may feel that you can't even generate feelings of love in your most treasured relationships. You may lose interest or feelings of enjoyment for your favorite pastimes, eating, or even sex. Even though others may think you are doing better at these times compared to periods when you are intensely reliving the trauma. It may alarm you to feel so benumbed that lacking in feeling. Again, this is part of the normal response to trauma. Just as the iris controls the amount of light entering your eye in order to protect the retina, or just the body secretes natural anesthetic after the physical injury, so too does our system mobilize to protect us from being overwhelmed after trauma by numbing our feelings. Given the intensity of your feelings when you are reminded of the trauma, it is only natural that you will often strive to avoid such triggers. You may also find that your memory fails in recalling certain important aspects of the trauma. Such avoidance or memory lapses can be self-protective in the aftermath of trauma. However, it too persistent or too generalized, such responses may hinder your recovery. You may find that you go through periods during which you strive to keep the trauma out of your thoughts and don't want to discuss it. For example, you might bury yourself in your work so that you're so busy you can hardly stop to think. This is the opposite extreme from periods during which the trauma consumes your thoughts and you desperately want to talk about it over and over and over again. You may find that the harder you try to keep thoughts of trauma are your awareness, the more they intrude in other forms, nightmares or periodic flashbacks. You may find that you experience either hopelessness or fatalism when you consider the future. You may become preoccupied with ideas that won't retain your health, that you won't have the love of others, that you will die young, or that loved ones will be especially vulnerable to future catastrophes. Other symptoms of increased arousal: trouble falling or staying asleep, difficulties in deciding anything, irritability, difficulty concentrating, outburst of angers, spasms of grief, hypervigilance about safety, startle reactions, bodily reactions to reminders of the trauma, such as sweating, nausea, trembling, pain, hypervigilance, or even a knot in your stomach. Depending on the nature of your trauma and your experience and how it was caused, you may notice any of the following things: possible effects and beliefs, attitudes, and sense of self. The world feels unsafe, unfair, unpredictable, out of control. You have a sense of separation from the rest of humanity, loss of autonomy, mobility, or even your freedom, sense of betrayal, unfairness, or mistrust, self-blame, diminished self-respect, sense of degradation, humiliation, or personal weaknesses, indifference, fatalism, or cynicism, even guilt or shame about surviving, especially if others did not. Rage, thoughts of revenge, and aggressive impulses and related guilt. Anger at people who have not been affected by the trauma. Your sadness of other losses. Spiritual crisis, or even loss of faith. How can this all be just in my head? It's not. Researchers have demonstrated that exposure to severe trauma often results in persistent alterations in bodily functions. For example, the levels of several neurotransmitters in your brain may be affected by trauma, which can contribute to your symptoms. Some studies suggest certain parts of the brain may remain overly active after trauma. Disruption of your sleep cycle after trauma also contribute to your symptoms. Your baseline level of arousal, as measured by a resting heart rate and blood pressure, may be persistently elevated after trauma. When something traumatic happens to one person in a family, often everyone is affected. Different people's trauma may have various and vary considerably. It may seem that some are over or under reacting. Often this is because one person in a period of being benumbed, while another may be in a period of over-arousal. Family members often experience changes in their world, view or spiritual crisis of their own. They may also have intense feelings of guilt, anger, or sorrow about what has happened to you, which can sometimes make it difficult for them to be careful. That's how this trauma can affect your family. Why am I so upset about responses of others to me? Unfortunately, the police, the justice system, reporters, medical personnel, even the clergy and others can respond to the ways that compound your feelings. This is sometimes called secondary trauma or secondary wounding. The ignorant, patronizing, impatient, insensitive responses of others may leave you feeling ignored, blamed, or treated like a child. Even well-intended loved ones who care for you and are eager to see you recover may respond to you in ways that compound your feelings. Sometimes your upset about such reactions from others may seem worse than the trauma itself, or you may become preoccupied by it. Remember that sometimes people may avoid you or even blame you because they don't like to be reminded that bad things can happen unpredictably to good people. What can I do to help myself? This part of the natural part of recovery process as you struggle to integrate the experience. If this proves to be too upsetting for your loved ones, or if you feel you cannot talk with them about parts of the incident or certain feelings that you have, then you may need to find other confidants, mental health professional, minister, or support group who can understand and tolerate such a need. Sometimes it's helpful to look at photographs or other reminders of, or to establish a memorial to someone or something that is lost. Tears can be healing. Give yourself permission to feel all your feelings, even those that don't make sense or even go together. It's important to give yourself time. Allow yourself to learn on others and to lean on them a bit when you know something will be difficult as a result of a former trauma. Many people who have experienced trauma try to control or diminish their symptoms with alcohol, only to have their drinking compound their problems. Even if you do not feel like actively relating to others, find ways to be in the vicinity of others. Occasionally, you may need to withdraw for a day or two to regroup and then come out again in your life. This is normal. Remind yourself that it will take patience and effort to recover, but that you won't stay stuck in your worst feelings. Remember that you can't make yourself recover quickly by sheer focus of will. Give yourself the latitude to sometimes not have good days, and you will have bad days too. Trauma means wound, deep wounds that take time to heal, even if you do everything you can and get all the support that you need or you think you need. Your doctor or mental health agency may be able to direct you to an appropriate group. If no group is available, you may find it useful to make individual contact with someone who has survived a similar experience. It may be important for you to seek further information about the event, like talking with witnesses, reading news stories or police reports, or contacting other authorities for details about the event or its aftermath. Don't rush into this. You may find this easier if you ask a loved one to accompany you. In 1987, I had a horrific car accident. A lady ran a red light, hit me in the intersection, blindsided me, T-boned me, pushed me into an oncoming semi-truck. This was a horrific accident. I was unconscious all the way to the hospital. And little did I know all the things that were going to be told to me. I had traumatic brain injury, mild traumatic brain injury. I had 12 other injuries to my body. I didn't know which way was up or down. Yes, I was a Christian. Yes, I called out to God. But I didn't need people coming in and just reading Bible verses and say they're going to pray for me. I needed people that would actually pray with me, that would actually just sit there and not say a word. I was so traumatized. I developed post-traumatic stress. I cannot tell you, when you're going through that, you have all the answers. You know the scripture, but you're trying to make sense of everything in that traumatic event and the aftermath thereof. So be patient with those that you'll be ministering to that have gone through any type of trauma. Don't rush into it. You may find this easier if you ask a loved one to accompany you like I did. My wife went with me, and I sat in the vehicle that I almost died in. It was important for me to experience that and to see the result of that accident. Others may feel that you are needlessly torturing yourself, but sometimes details, however terrible, provide relief. I was glad that doctors told me the truth, not only my diagnosis, but my prognosis and what I would have to do for healing in my body and my mind and my spirit. Consult the references noted below to seek assistance from an expert who can help you develop such skills. At some point in your recovery, you may feel that you have things that don't make sense. Take time to learn muscle relaxation, imagery, breathing, skills to help calm yourself. If the symptoms especially upsetting or especially persistent, you need to seek a professional help. This might mean a psychiatrist or a psychologist. I was dealing, in that car accident, I was dealing with 16 different doctors. I had to carry a notebook around, and my wife had to write things down just so I could keep up with all the medications, what the doctors wanted me to do. And as you know, sometimes doctors do not actually communicate with each others. Do not assume that all counselors understand post-traumatic stresses, appropriate treatment. If you need a referral, discuss it with your family physician to see if our special resources in your community, such as counselors, understand trauma. I read I don't know how many books about that. Rape Crisis Center, special clinics. Call the psychology or psychiatric department of the nearest university or medical center. And maybe you might even need to reach out to 1-900-737-3400. That's the Anxiety Disorders Association of America. If you aren't sure about a name you have been given, ask the professional about the nature of their experience in working with people after trauma. That's very, very important. There are various medications which may be helpful in treating post-traumatic symptoms, yet there is no consensus of choice. For example, 3 different classes of antidepressant medications may diminish your sleep, give you sleep disturbances, nightmares, or flashbacks, even if you're not feeling particularly depressed. Some drugs that are ordinarily used to lower blood pressure may help with startle responses and intense relieving experiences. Anti-anxiety medications must be carefully handled by a doctor such as a psychiatrist that understands it. Expect sometimes short-term memory means diminishing your symptoms and helping you sleep. That's important. Sleep is a great healer. Some of these choices may not be appropriate for you, and others may have uncomfortable side effects. More than one drug trial may be necessary before you get satisfactory results. A drug trial might require several weeks before its effectiveness can be evaluated. The choices should be discussed with your family physician or with a psychiatrist that specializes with patients, as I've said before, and post-traumatic stress. Especially important to consider medication if you are completely exhausted from lack of sleep, as I've said before. I'm reiterating this and repeating it because without sleep, you're going to develop significant depression and anxieties. So it's so important to reach out for people to get help. I'm reminded something that my wife wrote. Never let a problem be solved become more important than a person to be loved. As you counsel and you help with trauma, show love to that person. Help them to understand how that God loves them, and this is part of the valley they have to walk through. My daughter wrote, being in a valley is not permanent. You can get to that mountaintop if the valley is where you grow, and you will learn how to be what God has made you to be. He will strengthen you through every adversity in which you. It is my desire that you will use the things that you've learned today and use this PowerPoint to share with others within the corporate world as your corporate chaplain. This will give you some tools that will go a long way in reaching people for Christ, ministering to them in their spiritual, emotional, and physical needs. My friend, this is a golden opportunity when a person is in a crisis and shares with you that they are. Many times this is the open door to be able to share Christ at some point, because many times crisis brings us to our knees and we seek help to know what is the answer to all of this. Use this presentation in your ministry as a corporate chaplain. You have my permission to do so. Use it, add to it, take away from it, add some things. But this PowerPoint is a PowerPoint that can be used with believers and unbelievers alike quite handily. God bless you as you seek to minister in the workplace as God's man or woman, as a chaplain standing in the gap to help others.